Welcome to my channel. Today I am covering a series of stories of elderly abuse and neglect throughout the United States in 2024. All of these stories took place this year, some as early as 7 days ago. And I am covering these stories because they are not receiving the attention that it deserves. These stories display the absolute most level of neglect, abuse. I will say you may become triggered listening to these stories, seeing the footage. You may become triggered. So please be advised of that. I do not own the content in any way, shape, or form. I do not own any music heard. I don't own any transcripts. I don't own any logos. I do not own any content that you are getting ready to view. This video is The purpose of this video is to simply bring awareness to a topic that has gone unnoticed and unspoken of in the United States for years. That is the treatment of the elderly population.
A nursing home resident says she wasn't given a shower in over a year and that staff members are threatening and roughly handling patients.
Those are just some of the allegations state records show for a nursing home in Durham. WRAL Investigates Sarah Kruger spoke with residents who are demanding accountability.
And how long have you lived here at Carver Living Center?
1 year and 9 months too long.
Barbara Pascal called WRAL Investigates.
They know I'm not shy. I will tell it like it is.
Wanting to share a cautionary tale.
I pray every day and ask the Lord, is today my day, Lord? Please come and get me and take me home. Because that's where I'd rather be than here any day of the week.
She shared this photo with us. She says she was living in a room with mold for more than a month. She describes having to go days without medicine, saying the facility often runs out, and says nursing staff comes into her room vaping and even sleeps in the empty bed next to her.
And go to sleep, cover up, go to sleep, snore so loud I can't hear my TV.
A former manager wanting to stay anonymous wrote to me, Carver Living Center by far is the most concerning and scariest place I have worked in my 20 plus years in healthcare. He alleged staff would steal food that's supposed to be for residents, and there was so little already, residents were quickly losing weight. He detailed concerns about cleanliness and claimed some staff would work while on drugs. Medicare.gov lists Carver Living Center as a 1-star facility, much below average. In the last 3 years, 42 complaints have resulted in citations. It's been fined more than $200,000. State inspection reports over the last year and a half describe a resident upset because she had not had a shower for over a year. The facility was dinged for staff to resident abuse. One patient describing staff made a threatening gesture, others describing rough treatment.
I'm not trying to make a difference for just my life. I'm not going to be here a whole lot longer, but I want to leave it a better place than what I found it.
I went to Carver Living trying to get answers.
Hi, this is Sarah Kruger from WRAL News.
After a bit of waiting, someone who said he was a manager came out.
You're going to have to leave the premises.
Okay, could we leave the property together then and have a conversation?
No, not right now. I'm right in the middle of something.
Okay, would you be able to email me or call me back then?
Why don't you email me your phone number and I'll see if I can call you back.
I already had emailed multiple times with a long list of questions, but did so again. I still have not gotten a response. Sarah Kruger, WRAL News, Durham.
Sarah also reached out to the company that owns Carver Living Center, CCH Healthcare, and did not hear back. Now, if you have a story that needs an investigation, let us know. Send us an email to investigates@wrel.com.
This facility is located in Durham, North Carolina. And all in all, this I just don't understand how this facility is still operating with 42 complaints, 200,000 in fines. And you'll see this trend. You'll see the same trends in the other stories. These facilities are fined. They get a slap on the wrist. The state is like, okay, give me my money and we'll look the other way. You'll see this trend across all the other stories that we're getting ready to cover. These facilities do not respond. They do not reach out, whether it's in person, letter, bird, text, however you communicate as a human, they do not respond. 42 complaints. And they paid over $200K in fines. But it's like, when does money not become enough? So are they just going to continue to pay fines? Are people just going to continue to get paid? Is the neglect just going to continue? What happens when this facility in Durham surpasses $1 million in fines? Then what? Is there a limit as to when action can be taken? Or is there a limit? Is there a $500K limit? Is there a $1 million limit? When does it get to the point where fines isn't enough? When does it get to that point? You have residents who are neglected in terms of their hygiene. You have a lot of residents who are bedridden. You have a lot of residents who are unable to physically care for themselves. So the elderly population is completely ignored in this country. They've created all of these loopholes to siphon as much money out of the elderly population as possible. Life insurance, health insurance, retirement, Social Security, anything that is due to our elders, the state, the government, private sectors, they're all taking it back and discarding people as if just numbers. I mean, you listen to this quote. Listen to this quote. By far, this is the most concerning and scariest places I have worked in my 20 years in healthcare. And this facility is still operational. How society treats their elders says everything I need to know about that society. These stories rarely get coverage. These stories do not get covered as much as the conflict, as much as the violence, as much as anything that divides Americans. Anything that divides Americans gets traction.
Also at 6, a disturbing crime involving some of our community's most vulnerable.
Nursing home workers are accused of sexually exploiting elderly residents in their care. A warning before we go any further, the details are graphic. News 4's Amaya Ward has more from Logan County.
The Guthrie Police Department arrested 3 people who work inside this nursing home. All of them are facing serious allegations, accused of taking photos and videos of elderly residents without any clothes on, and much worse.
It's probably one of the saddest things.
The Guthrie Police Department first launching their investigation back in April after a former employee revealed disturbing details on what went on inside the Golden Age nursing facility.
Some employees were involved in sending some inappropriate pictures of their patients. We had found some pictures of some deceased persons. We had found some pictures of the suspects playing in pubic hair.
These women now facing elderly abuse charges.
They had excuses for some of their behavior that didn't really match up with the evidence that we had uncovered.
Court documents allege the three women would receive and send Snapchats to each other. One video sent shows an elderly resident lying on the bed wearing only a shirt and diaper. There was fecal matter on his bed, his sheets, and his socks.
We take service to everybody very responsibly, but especially for those who don't have a voice for themselves.
Investigators say they also found a video of a male resident lying on his stomach, nude from the waist down. And other photos showed residents who had died inside the home, with the workers allegedly mocking them. Police say they do not take these allegations lightly.
Without us and without other people that care, there's just no justice.
In Guthrie, Amaya Ward, Oklahoma's News 4.
That is awful. A spokesperson for the Golden Age Nursing Facility in Guthrie sent News 4 this statement, reading in part, the employees have been terminated and the employees involved had cleared background checks, were educated related to residents' rights safety. It went on to say, we are committed to protecting the privacy and safety of the residents and families involved.
How can people apply for this particular job, caring for the elderly, go through the job hiring process, get the job, and then commence to neglecting and abusing these elders? Now, this particular facility in Oklahoma did terminate the employees. Hopefully, these three individuals do get charged for their actions. But it's so many facilities that do not take these steps. There's so many facilities that do not take the steps that this particular one just took in Oklahoma. And this is a case. This is a case from this year. All of the coverage that we are looking at is from 2024. This is not an old case. This makes me question the moral compass of this country. How so many people in different states are becoming comfortable with applying to these nursing home facilities, going through the job hiring process, getting the job, and then they commence to neglect and abuse these patients. The rise of the amount of people targeting this population, taking their frustrations out on this defenseless demographic, it's angering. And the facilities get a slap on the wrist. This facility stated basically they have no idea how this could have happened. They followed the procedures in terms of hiring who they thought would be responsible workers. So how do we change the hiring process? Because obviously the current one is not working at all, because you have cases such as this all over the United States. This is in Oklahoma. The first one we discussed was in North Carolina. These three individuals in Guthrie took pictures of deceased patients. I think a new hiring process needs to be implemented, and it needs to be vetted by outside parties all across the United States. The hiring process needs to be taken out of the facility's hands, because who knows? Who knows what type of relationship the hiring manager and those seeking employment have? This case has senseless acts. It is disturbing. And it makes me question, okay, what kind of upbringing did these three individuals have? What is going on with the moral compass in this country for these three young individuals to take pictures of deceased people and post them? I think a further investigation needs to be done into this nursing facility, and I think they need to be kept under surveillance. Just because these three were caught, just imagine the people who weren't caught. Because let me tell you something, stuff like this, it's a network. It's a network. Everyone participates to keep their job. No one wants to be seen as the whistleblower. So everyone keeps quiet. Often not. Everyone participates because they do not want to lose their employment. They do not want to be seen as a whistleblower. So they go along with the antics. They go along with the circus. So this facility in Guthrie, Oklahoma, needs to be kept under surveillance. Just because these three were caught and possibly charged does not mean that there are others in this nursing facility.
In unrelated cases, a murder investigation led to an elderly abuse case being investigated by the Lafayette Parish Sheriff's Office. Patricia Verdugo says her family was first approached by a Lafayette Parish Sheriff's Office detective in November of 2023 about an investigation of elderly abuse at a Lafayette nursing home. News 10's Jasmine Dean speaks exclusively with one of the victim's daughters about how they were made aware of what was happening. It's a story you'll see only on 10.
My sister and I immediately went there. We viewed the pictures and the videos and indeed identified it was my mother.
Patricia Verdugo describes it as extremely hard when watching videos of her mother being hit and abused. She says her family was made aware of the incident by the Lafayette Parish Sheriff's Office after their investigation of a murder led to videos of her mother being abused surfaced.
There was a murder investigation that had nothing to do with our situation, and this video was found in somebody who was murdered's phone.
Verdugo says after seeing the videos, her family filed a lawsuit against the nursing home and the two workers involved. She says it's hurtful to know her mother, who suffers from dementia, was treated poorly and feels the nursing home did not want this to get out.
The nursing home's attorneys think that this isn't a big deal because she doesn't remember what happened. And it is a big deal, whether she remembers it or not. But they really would like to sweep it under the carpet because of those reasons.
She says since the incident, she's experienced different emotions.
It was devastating. You know, there were so many emotions. We were sad, we were hurt, we were angry. We're still all of those things.
And despite being present, she feels regret about not knowing what her mother was experiencing while living there.
We thought we did our homework. We were there every day.
34-year-old Crystal Howard and 33-year-old Dontrell Harris face multiple charges involving cruelty to the infirmed. Howard was arrested in connection to the case, while Harris has an active warrant for her arrest. In a statement, the Lafayette Parish Sheriff's Office tells us further details on this case are not available at this time, as all court proceedings have not yet concluded. Verdugo says the reason she is speaking out now is because she wants people to know this could happen to anyone and to be as cautious as possible when trusting a loved one in the care of others.
For the families, you know, that have family in any kind of nursing home or anything, like, pay attention, be there, be on top of things, talk to people. Because I guarantee you it's happening everywhere.
This third case that we're looking at of elder abuse in 2024 in the United States takes place in Lafayette, Louisiana. So we have Louisiana, we had Oklahoma, we had North Carolina. So just like the woman stated at the end of this video, this is all over. This is happening all over in the United States. My question about this particular case is, if they were never investigating a murder at the same location, her mother's elder abuse would have never been brought to light. This case reminds me of the soldier that went missing in formerly known as Fort Hood, now named Fort Cavazos. Vanessa went missing at what was known as Fort Hood. And while they were searching for her, authorities found other people. This is what this case reminds me of. Y'all are investigating a murder, and y'all end up finding other things. So if they were never investigating the murder, her mother's neglect would have never been brought to light. So this entire facility needs to be investigated by an outside party, an outside source, outside authorities, because clearly there are other cases of neglect, possibly even murder, going on at the same facility in Louisiana. I urge people, try as hard as you can to care for your elders at home. They are better off waiting for you to get home from work to care for them at this point. There are elders within these stories that we have went over who haven't showered in days, who haven't eaten in days. They're left alone for days, months, even years on end. If you are able to care for an elder, please, I urge you, please try for as long as you can before considering a home. Because these cases are mounting. It doesn't matter how much money you have. It doesn't matter if you're a veteran. It doesn't matter how much you pay for the facility. All these homes, these privately owned for-profit homes, all they see you as is a monthly deposit. All of these private homes, all of these for-profit care facilities, they just see each individual as a deposit, and that is it. If you have someone elderly in a nursing home, check on them daily. Make your presence known. Let it be known that they do have people who care for them. Call. If you cannot physically visit the facility as often, call. Call, email, send a letter, send a pigeon. Stay in contact with this facility. Let that facility know that this particular elder does have somebody who cares, and you are willing to go the extra mile to make sure that they do their job. You want to be the type of person that when that nursing facility sees you coming, they're like, oh God, here they come. Here they come. What they want, they already know. They already know. You're not going to turn a blind eye and just let them have their way. These are the two individuals who are involved, allegedly. I have to say that because they're, as the video states, that all parties are presumed innocent until proven guilty. So these are the two individuals who were allegedly involved with the elderly abuse at the nursing facility in Lafayette, Louisiana.
Well, more than 70% of nursing homes in the U.S. are now owned by for-profit companies. And new research is bringing up questions about the quality of care. So a CBS News investigation looked into a troubling trend of ownership arrangements among nursing homes that are contributing to poor patient outcomes. So most facilities rely on taxpayer money from Medicare and Medicaid. But as profit-seeking investors have swooped in, it's been more difficult to track where that money goes. So CBS looked at Berkeley East in 2019. That facility was taken over by for-profit company Aspen Skilled Healthcare. Well, we spoke to one former employee who worked there for more than a decade.
When we try to call upper management, they wouldn't even pick up the phone or call us back. They would just leave us short on the floor. Labs weren't being reported in a timely manner. Patients weren't given their medications on time.
That nurse also alleges that Aspen took steps to conceal staff shortages from the state. That nurse also alleges that Aspen took steps to conceal staff shortages from the state during the pandemic by falsifying documents. Data shows that while Berkeley East operated at a loss, its parent company, Aspen, reported more than $27 million in annual profits. The company declined to comment.
So the parent company, the private health company, Aspen, generated $27 million in profit. They do not answer the phones for their own company. They do not respond. But yet they're taking the money and running with it. You see the trend in all of these cases. No one is responding. No one is reaching out. No one is providing any answers to multiple questions. Employees are not vetted properly. The staff is running on fumes. Facilities do not have the personnel they need to care for the amount of people they are charged with. You have elders missing appointments, not taking medications. I mean, the nursing care is a circus. It is a circus right now. And you have these private companies coming in and running off with millions, and not even having the decency to pick up the phone and respond to their own staff. Aspen, companies like Aspen, they won't even respond to their own medical staff. So how do you think they treat patients and families of patients if they don't even respond to their own medical staff on ground? We need to start looking into who exactly owns these private companies, who sits on these boards, who is employed, who is the directors. We have to start looking at who these individuals are. Where is this money going? $27 million. And you have patients lapsing over medications. You have patients not making it to appointments. You have a facility that is understaffed. You have a facility that is understaffed, but yet you made $27 million. So where is this money going? And this case is in Chicago. So you see, we're going all over the United States and we see the same thing happening. It doesn't matter about the facility's location. It doesn't matter how much money you earn. It is the same trend every single state. Chicago, Louisiana, North Carolina, Oklahoma. It is the same exact trend of neglect and seeing the elderly population as just deposits.
Well, right now, a 75-year-old disabled veteran is in ICU and on a ventilator after his family says his Coppers Cove nursing home neglected him.
The family contacted the state about their concerns with the living conditions and lack of communication with his medical history. 6 News reporter Sydney Deshawn has been investigating this and is here to bring us all the details. Sydney?
Yeah, Chris and Lindsay, the family calls this unacceptable and now they're taking action. We do want to warn you the images you're about to see are very graphic.
I'm sorry, it's just so disgusting. It has 123 beds. These are people's loved ones. These are people that can't talk. I can only imagine how they're being treated behind closed doors.
Lacey Percival is the daughter of 75-year-old Robert Turner. He was a patient at Coppers Cove Nursing and Rehab for 18 months.
We were in a car accident. Then I could no longer care for him.
Things took a turn for the worse.
I have endless, and I mean endless, voicemails of my father.
Lacey, please try to help me. My call light has been on for 2 hours. My urinal is full of piss. I'm sitting in and no one's coming by. I'm all alone in this little room. I just feel so depressed.
It always had to get to the point that he had to call me and I have to call to make something happen, and that's the only way something happened.
On October 8th, Percival visited the facility.
Tuesday, I spent 3 hours with my father cleaning his room, cutting his hair and his nails.
She said she had enough, so she took matters into her own hands.
I have been in contact with the state in regards to my father's personal hygiene, his overall care, the cleanliness of his room, all of these things, missing medical appointments, not being rescheduled.
October 10th, her father left the nursing home unresponsive in septic shock.
They performed a CT scan and it showed an enlarged left kidney on my father. Further assessing him, they found a stent. That stent became infected because over the course of the last 2 months since that stent was placed on August 15th with the discharge paperwork to follow up with urology in 1 week, was just overlooked. Since the stent traveled up, it was infected, traveled up into his kidney, and the septic shock, his kidney, heart, and lung are now all failing him, and he is fighting for his life in ICU.
Texas Health and Human Services confirmed they are actively investigating the facility, but couldn't provide details of what they found.
I have questions and I want answers.
ProPublica, an investigative nonprofit, found the nursing home has been penalized multiple times by the state, with $118,000 in total fines between 2021 and 2022. They also had multiple deficiencies last year too. That included an F grade for nutrition and diet and a D on quality of life care.
The nursing home is still up and running. Clearly the state system is flawed. We just proved that. So who's checking the state?
Percival says she feels both the nursing home and the state failed her.
Family members need to stop tolerating this. Family members are afraid to report it due to the repercussions, and they're not wrong. If your loved one is in a nursing home, please be their voice. Please check on them.
Now, I went to the nursing home and asked for a statement. They declined and escorted me out. If there are more concerns about abuse or neglect, Texas Health and Human Services is urging people to call their incident intake hotline. That number can be found on your screen and callers can be anonymous, guys.
Yeah, your story was terrific, Sydney. It brings compassion, but it also makes us angry. Wow. Thank you.
This is the last facility that I am going to add commentary on. Here we are again with the penalties and the fines. So this facility was penalized $118,000 for various things, complaints, malnutrition, all kind of issues. And all they did was just pay the money. And they continued operations as if everything was fine. In our last story in Chicago with Aspen as the private health owner of one of the facilities, they generated $27 million. So you see where, okay, $118,000 is nothing. And that is why these cases continue to rise, because they're generating millions and they're getting these fines, slap on the wrist. Okay, here, $96,000 fine, $20,000 fine. These fines aren't going to do anything. Just like the facility in Durham, North Carolina, they were fined $200,000 over. They were fined over $200,000, and they're still in operation. They refused to release any statements. The news station went to the nursing facility in Durham, North Carolina, and they said, "Yeah, I think it's best that you leave." So they didn't even provide a statement. They provided nothing. So I mean, that should tell you what these fines mean. They're nothing. This is nothing. When does the state stop taking these payouts and say enough is enough? It involves a veteran who should receive top care. He should receive the best care for serving his country. And here he is with roaches in his room. His air ducts need to be cleaned. His physical health deteriorated rapidly after he arrived at that facility. You see older pictures of him and you see him later in life, and those conditions, physically and mentally, he deteriorated. He stated his urinal was filled. The device that he calls for help with has been on for hours and no one has arrived. The elderly population is rising. And that is why you have these private health companies swooping in, because all they see is a quick deposit. I feel sorry for what this man had to go through in his own country in his final moments in life. He had a splint in his leg that traveled and caused damage to his kidneys. I'm not going to show the other footage of his health issues, but his leg was clearly swollen. It's like, how could no one in the facility not see that and immediately say, you know what, we need to send him to the ER. We need to send him somewhere to seek help, because this is not normal. But he had a splint in his leg that was unattended for who knows how long, hours, days, weeks, and it traveled. It was unattended for so long. It traveled to his kidneys. He suffered shock. The employees didn't even have the decency to change his urinal. It's ridiculous. It's ridiculous what the elderly population has to experience in this country. I want to thank everyone for viewing this video. I want to thank everyone because we all will join the elderly population. So if we don't start advocating, if we don't start demanding the care that we want to receive, by the time we get older, there's no telling how the nursing care, nursing home, nursing facility industry, and yes, it is an industry, there's no telling how or where it will be by then. You have more for-profit and you have more private agencies coming in and turning this into an industry instead of a health care. You have a demographic at the most vulnerable time in their lives being taken advantage of, and their voices are not being heard, and they feel defenseless. They feel as if they are just a deposit. They are just a number. So that is why I made this video. It is a very close subject to me. And it should be a close subject to you. So thank you for listening to my commentary. Thank you for being interactive with this channel. Thank you for liking. Thank you for commenting, subscribing, sharing, however you interact. Thank you.